If you feel a sharp catch in your lower back every time you bend down to pick up a shoe or stand up from a chair, your spine is acting like this mechanical hinge, holding immense tension and cracking under the load. Correcting how the spine handles these forces involves a specific daily routine, one preventative lifting technique, followed by 4 targeted stretches designed to address common mechanical failure points. Before you attempt to correct your posture or stretch out the pain, we need to ensure your back issue is actually mechanical and rule out any critical neurological red flags. This infographic shows the 4 specific medical warning signs you need to look for. Check if your pain is accompanied by a loss of bladder or bowel control, a fever, numbness radiating down your legs, or severe pain that does not improve with rest. If you are experiencing any of these 4 symptoms, stop this tutorial right now. You need to seek a 24-hour medical emergency facility immediately. Securing your back health requires separating standard muscle strain from a severe structural or neurological emergency. Once you confirm your pain is purely mechanical, we can start repairing the mechanics. Most of the pain you feel when bending doesn't come from a single, sudden injury. It comes from years of repetitive, incorrect lifting mechanics slowly wearing down your muscles and tissues. Bending at the waist turns your spine into a fulcrum, forcing stressed lumbar vertebrae to absorb all lifting force. By switching to the squat lift, you bypass the spine entirely. As posture shifts, tension leaves the lower back, distributing weight through the thighs and legs. To execute this correctly, start by stepping as close to the object as possible. Plant your feet exactly shoulder-width apart to create a stable base. Next, lower yourself downward. Keep your back entirely rigid and bend exclusively at your knees and hips. Think of your hips as the only hinges your body has. When you are ready to lift, drive upward. All of your upward momentum must be generated by pushing your feet firmly through the floor and engaging your leg muscles. There is one crucial check here. If you feel the strain localized in your lower back instead of your thighs during the lift, your core has collapsed. Stop, reset your stance, and try again. Keeping your back pain-free means changing how you approach movement. You are no longer lifting with your back. You are turning every lift into a controlled leg press. Now that we have corrected your lifting mechanics, we need to address the damage already done. This 4-movement floor routine reverses the spinal compression and muscle shortening caused by hours of poor posture. This animation demonstrates the cat-cow stretch. Arching the spine upward and sinking the abdomen downward facilitates tension release between your vertebrae. Next, moving into the knee-to-chest stretch releases localized tension in the lower back and hips, actively decompressing surrounding tissues. The 3rd movement is the pelvic tilt. While still lying flat on your back, keep your knees bent and place your feet flat on the floor. Use an isolated abdominal contraction to aggressively flatten the natural curve of your lower back directly against the floor. Pay close attention to your legs here. You must not use your feet to push off the floor. The physical movement to flatten your back must be generated entirely by tightening your stomach muscles. Finally, perform a hamstring stretch. Tight thigh muscles physically pull downward on your lower back. Gently stretching the back of your thighs severs that downward chain of tension. Practicing these 4 precise movements daily targets the mechanical drivers of back pain. You restore flexibility, decompress the discs, and build the core strength required to hold your spine safely in place. The squat lift and decompression routine will resolve most muscular strains. However, if your pain is persistent or worsening despite these exercises, you are likely dealing with an underlying structural failure. This cross-section diagram shows what happens during a herniated disc. The shock-absorbing pad between the vertebrae bulges outward, directly compressing a nerve root and causing the shooting pain of sciatica. Structural failures require direct medical intervention. Depending on the severity, treatments range from targeted physical therapy and posture correction to specialized pain management injections. For advanced structural diagnoses and resolution, the spine and orthopedic specialists at Arka Anugraha Hospital in Bangalore provide top-tier precision care. To initiate care, review the contact details on screen. You can book instantly on WhatsApp, call their dedicated line at +91 901 9704 252, or visit their 24/7 facility in JP Nagar Phase 6. Maintaining back health is a continuous process of daily biomechanical discipline at home, supported by the advanced medical resources of Arka Anugraha Hospital whenever professional intervention is necessary.